A big hello to all our viewers and audiences on this live broadcast session by VOH, Voice of Healthcare. My name is Sanjay Jha. I am co-founder and director at Collateral Medical Pvt. This is a medical device distribution company which we started around 8 years ago, and we do medical device distribution to all across India, focusing on tier 2, tier 3. Before that, I've been a medical device guy. I've worked with GE Healthcare. I've worked with Johnson Medical. So been in this area for 20 years. R&D is one of the areas which I really admire, which I love. And so getting to that idea mode, today we are fortunate to have with us Mr. Jacky Ovadia, founder and general manager, IDEA, International Innovation and Business Development from Israel. Sir, it gives me great pleasure to welcome you to this very special episode of Futuristic Fridays, hosted by VOH Broadcast Network. Our big goal today is to look ahead at the oncoming future through the lens of research, innovation, and trends that are fast unfolding on the horizon of healthcare. And for that, what better than to gather unique knowledge, insights, and inspiration from a leading dynamic mind such as yours. The more we spread our ideas and stories, the stronger we make our community. We'll be having a free-flowing chat. Our audiences and viewers are eager to know your esteemed views. And so, without much ado, let's begin.
Sure. Good morning.
Yeah. Let's start with focusing on the topic of this session itself. What, according to you, is the scope of digital healthcare in the near future, considering the current scenario of the healthcare industry?
Well, I was thinking a lot about it. First of all, good morning, everybody. It's a really pleasure to be here with you again in India. And it's fascinating to remember the scenarios. I've spent a lot of time in India. It was great. So back to your topic question. So I think we are in very exciting era where the penetration of technologies already exists there, like digital health from all of the kinds of it. And it's whether it's the smartphone with your camera and whether it's AI analyzing amounts of data to have a better idea what to do with the patient. So from many points of view, many angles, it's already there. But something has been changed with this COVID-19 pandemic. Now, I think it's a great era. It's a great time for all of us. There were two things that happened in the coronavirus, let's say, time. One is very good, and the one is very bad. Like, if you would deep thinking about that, now all of the budgets of all of the big industries, whether it's pharma or whether it's innovation, everybody is going into the COVID-19. So yes. There is not focus, they don't focus money or time to do what they need to do. But the good thing that happened that people are afraid to go to the hospital, people are afraid to go to the doctor, therefore they are willing to use digital health. Which was nothing, it wasn't being understandable before. It was it was very common in places like New Zealand or Australia where the gaps are huge, and there wasn't any digital clinics in the real ones in the United States. But now, when you want to do in a big hospital a follow-up with a patient, what can you do? You have to use it. So I think. It's about the New York Times have said that it's a giant leap of 10 years. What happened in this 3 months, 4 months that we are exposed to COVID-19. The same here in Israel. In Israel, there was a good foundation to start digital health, but people didn't use it so much. But now they don't have choice; they have to use it. Whether they are visiting their mother and fathers through the smartphone with the video, or whether they are speaking with a skin doctor and picture their skin and ask questions about their situation and have a prescription by mail and get it by a courier from the pharmacy. Now it's working and it's penetrating very fast.
Yes, and I see the exact same trend in India as you shared. Here, lots of doctors are now available online. Lots of video calling happening. So the consumption of data has increased significantly, and suddenly healthcare became much more available in one way.
Yes.
So yeah, completely echo your thought there.
Now, our responsibility as customers or as the industry is to demand from the government and the communication companies to support us with the right foundation for that, whether it's fiber optics or faster or G5 in cellular. It's
Hmm.
all about that. You are a technology person. I'm more about marketing and service, but it's we have to have the right foundation to give service to all.
Yes, completely agree. That's the base where you start from. So one of the interesting other trend is on the medical tourism, right?
Yes.
See, uh, if you see, earlier people used to just come here, go there, right? And you being an expert in that area, okay, how do you think that in the field of management of medical tourism and international medicine, how do you see digital healthcare fitting in these domains of the healthcare industry?
Oh, this is a great question. I think the medical tourism is one of the pioneers of using uh, digital health in the work, mostly in telemedicine, mostly, but not only. If you would look at the Da Vinci robot, the first idea of using Da Vinci was to have the ability to do surgeries from far away, where your surgeon can sit in Boston and the patient can be in Mumbai or in Delhi and get his treatment by the hands of specialists in that domain of liver or whatever. So medical tourism was the first one to use those because there is a lot of money in medical tourism, and
Mhm.
people that can afford themselves go to other countries to have availability or to have speciality. So they have money to pay. It's a private money. It's not governmental money.
Mhm.
So hospitals are attracting people and using the best technology or the best physicians.
Mhm.
So one of the good domains to penetrate or to try new stuff is the medical tourism. But let's speak about a patient want to go abroad, so we can communicate with the help of his local doctor, the other doctor. They do consulting together. They might use AI or you are from the imaging industry, so you would know Zebra Medicals or other, like everybody's using AI today. You have
Mhm.
a great pioneer people in AI in imaging in India, by the way.
Mhm.
Um, so he can do screening, he can do diagnosing, he can use AI, and he can give a recommendation what to do. Now, the patient comes for the surgery, and then the follow-up can be done also from far away. This is one way. When I
Mhm.
was working in my country to promote
Mhm.
medical tourism, one of the things was not just medical tourist, it was also, we called it academy or international academy. We
Mhm.
were working with doctors, mostly from Russia. Most of our patients are coming from Russia.
Wow. Okay.
Yeah, because of the situation in Russia, because many immigrants from Russia came to Israel as Jewish that left
Correct.
Russia.
Correct.
So there are good connections. Most of them, or a lot of them, were doctors. So they still have patients. So their patients followed them here. So
Wow.
yeah, and it was a great time. Today you don't fly so much. Still,
Mhm.
they come and they do consult by telemedicine. They do
Mhm.
diagnostic in special diagnostic centers that was opened by Israeli companies in Russia, in Moscow.
Okay.
One of the idea was academy. So you get a doctor for a guidance here
Mhm.
for a course. He learn a new procedure. Let's say to learn how to move or to do a bypass in new techniques, or how to put a new valve, or how to put a new pacemaker, and then he go back to his country. Now, who is doing his first new surgeries? Who is escorting him? It's really his hand can be shaking, because
Correct, correct.
he missed his mentor guiding him. So he can use
Yeah.
today a follow up, or he can use today an on the job training using Hololens or any other like Google's, that he can hear his mentor with him. So if
Yeah.
the line is good enough, so it can be alive. They can see the same monitors. They can listen to what's happening in the surgery room. So it can be an international academy. So let's take, for instance, the big hospitals in India using the same techniques when they teach doctors from other countries how to do the work. The follow up can be done with this, and they can guide them in the operating room with the technology.
Wow, that's very interesting. So we are talking about not only the medical tourism, we are also talking about education, which I never really thought about earlier. So
Yes, I've changed the terms. In Israel, I don't use more medical tourism
mhm.
because I don't think it's a tourist. It's international patients. So I call it international medicine, because nobody is touring around to do a liver transplantation. You don't go for touring. It's not it's
Yeah,
not a
yeah,
pleasure.
yes, yeah, certainly not by choice.
But it's about to having a better service, to have accessibility to experts, and also accessibility to technology. Sometimes you don't have that technology in your country because of regulation. Let's say there are patients coming from the big United States to Israel to do their operations, because sometimes you can't have this technology in the States. Like, I don't know if you heard about T cell as a treatment
Yes,
for cancer patients. You,
yes, yes.
you can do it in Israel, you can do it in China, but there are some places where you can do it in the States. Or stem cells to cure eye problems. So when
Mhm.
you are using new technologies, whether it's new procedure, whether it's new machinery, you can have the best of it. By the way, when I came to India, one of my um, loved tours was to see our hospitals. And I've seen a beautiful hospitals. I think you are a leading uh, superpower of medical tourism. India is great. Really, you
Thank
have
you.
very good hospitals and excellent surgeons. Really, the treatment is great. If I would take Apollo, Fortis, Max, Khalida, Induja, very, very good hospitals, amazing hospitals. Sorry if I forget some brands that I was visited.
No, I think India has come a long ways. So India was anyway known for good surgeons, and now also the infrastructure has come a long ways. So we are able to provide really quality healthcare.
So if you ask me about medical tourism in India, I think it's a great opportunity for India itself to follow up the medical tourism business that you have already, and to help them to innovate and to implement medical tourism tools from new technologies. It should be with the help of the government, and then you can have more patients for sure. And then you can have better quality of care also for the rural areas, because what is a medical tourist? He come from
Mhm.
far away. So, and they do a follow-up later on from far away. So it's the same with the rural areas. You can do the follow-up, you can do the screening for your own poor people with telemedicine.
Completely agree. So, so talking about the international healthcare and the business development and innovation. So, since your latest venture of Idea deals majorly in business development and innovation in international healthcare, do you think digitization of marketing and business development is the need of hour?
Can you repeat the last sentence?
So, So, do you think digitization of marketing and business development is what we need right now?
For sure, we were speaking about COVID-19 before. For sure, people will drive less in planes, and less to their far places. Everybody have learned to use video chat or Zoom or any other technology that can access other places. And the big development of commercial, digital commercial, like Amazon, everybody can open his own shop. So the future is there. It's also about serving the amount of people with community care. We were speaking about primary care and secondary care. So
Correct.
the future is in digital automatic machine. I don't believe in robots and automation for sure, because you need the care of a person, but I believe in a hybrid medicine. So
Okay.
for sure, tomorrow, and we know that in the States it's happening already, the primary care will be controlled by Amazon or giants like Google Health, or I don't know, Alibaba, because of it's more accessible, and because you can have more tools that can analyze your skin or your health with your smartphone. For sure, it will happen. So in marketing, it will come very quick, much more when we think now with the COVID-19, it's a matter of regulation. How would the ministries of health will support those regulation? It's more about that. And there is a lot of, let's say, fighting between the new era and the old physicians that want you still visit their hospitals or visit their clinics. But I think they can't resist. One of the most fascinating places to look at that is China. When you go to China and you are a diabetic patient, you are going not to your physician, you are going to the hospital, because they're not used to see clinics outside of hospitals. Because like it's totalization, like they were in controlling people. So at the past. So now they still have a habit to go to the hospital with every small thing. So when you go to the hospital to see a doctor and you are diabetic patients, you are wait on the line for 1 kilometer. And the poor doctor should see thousands of people a day. He can't give a good treatment. He can't give a good
Yeah.
treatment. So there is a gap of clinical in the community. And the solution for that is the same solution as India needs in the rural areas when you don't have an access to a doctor. So it's about digital clinic. It's about a cloud that collect your data. It's about AI that analyze your data, and it's about recommendation. Now the question is whether you have a mobile pharmacy that come for you, or whether you have a drone brings your medications to you. We've seen that in Rwanda, because you have to keep the medication cold, and you don't have that village refrigerator. So we see that in Africa already happening with the support of the World Bank.
Wow. So removing the challenge of access by using new technologies.
New technologies, cloud, analytics, telemedicine, it's all in it. There are 5 domains in digital health that you can count. It's about remote monitoring, it's about telemedicine, it's about M-health, it's about
Yeah.
healthcare IT. And there is another issue that we haven't been speaking about. I think this is the future of health. When you see, we are speaking about medicine, we're speaking about sick people. We don't speak about healthy people, which is most of us, Nobody is collecting data at your health medical record from healthy people. But think about it, that now with my Fitbit or with your Apple, this is Fitbit, I can collect more and more data as a healthy person. I can have collect this data in a cloud, and tomorrow, probably as some others, I would have a heart attack. So if this information was in my health record, I could predict with the help of AI with some other cases. So we call it wellness tech. I has established a wellness tech forum in Israel. It's behind me, and
Mm,
the
wow.
idea, yeah, the
Yeah.
idea was the idea was to connect between healthy people and sickness. And when you are analyzing data of healthy people that get sick, you can predict who is going to get sick and to give us an early sign. Please, we have learned you can get a phone call saying, look, Sanjay, in 2 hours, relax, everything is okay, but in 2 hours you're going to have a stroke. So you
Oh
better
my God.
you better go to the hospital now.
Uh,
So before getting a heart attack or a stroke in your mind, you can get a good medication and to solve it out without operation. Or take an aspirin now. And most of people who before they get sick, they are healthy, and now we can control with the help of that. So the next HMOs or clinics will be about treating healthy people and preventing medicine. And preventing medicine is the future, I think, with digital.
yeah. So it's always, or the focus always used to be
Mhm.
diagnostic and treatment,
Sure.
right? And now all so much of data and so much of new technology coming in. Wellness plus diagnostic plus treatment. That's what
Yes.
makes it healthcare,
Yes. There is
right?
the Obamacare. I don't know if you remember. Obama, when he got in, he was worried about the situation of health um, accessibility in the United States. It was very expensive in the
Mm-hmm.
JDP. That they were spending 18% of the GDP of America
Mm-hmm.
for treating people, and he saw that it's a big it can bring the United States into a big recession. So he wanted the solution, and the solution was to do preventive medicine and to invest in preventive medicine to guide people how to live right, how to eat right, how to exercise, and to do preventive medicine. And the idea was there was some economic guys that was working on that, and they found that they could cut uh, the budget from 18% out of the GDP into 8% in 5 years if they just would work on preventive medicine. So as I look in India, I see this is the future of India because India is a young nation. It's an old nation. You were just celebrating 70, isn't it?
Yes.
75 years or something like that. 70 years.
Independent since, 75, almost 23 years.
Since 1947, right?
Yeah,
Okay, I
73.
think it's very close to Israel, by the way, because the British came out of India the same with Israel. And so you're very young, but your population is very young. So and it's giant, and there is not enough budget to treat all. But the good idea is to have Ayurveda back into your life, or preventive medicine, and to bring it as a part of the, let's say, obligation of the HMOs or the health funds also in India. And while we're speaking, I remember when I was meeting the managers of Voice of Health in India, I met them in October. It was great seeing that you were thinking in those way, and it was great to meet the people from Voice of Health and to listen to that.
It's a very young and good team. So, and India also somehow we had focus on wellness. Okay, if you look at yoga, for example,
Yoga
that is
or Ayurveda, yes.
right. That's a perfect example of focusing on wellness. But very interesting way you look at the healthcare going forward. So
Mhm.
what's your advice to the healthcare stakeholders who want to go digital?
To be brave, to try,
So,
to be brave and to
what
invest in new technology. This is the future.
what are the typical challenges you think you will face?
The challenges. Oh, I don't know where to start. First of all, let's speak about the stockholders. If we're looking at the governments, as a stockholder because they are obligated to treat, whether it's the region or whether it's the federation. We don't care much about. So you should decide what is your ethical code serving your population, what it should be obligated by the government, like what is the foundation of treatment. In Israel, there is a good law of health, which is cover everything, which is about saving lives. And some of it is about quality of life. Like lately, they put in also to treat teeth of elders. Tomorrow or in a few years, it will be also everybody. Now, it's about the budget you have. It's about your social ideas, what you think all the citizens should have. So there is private businesses and there is public businesses. It's very close to what there is in India, in England, where the NHS is treating everybody. It's like this in Israel. We have 4 HMOs, we have health fund. In India, I think you are doing the first steps into this, like a public law that everybody will be covered, like the Ayushman Bharat. It's really important. So I think this is the biggest challenge. So when you look at the Ayushman Bharat as a target audience, you should find out how you do more treatments, how you treat more people with less money, how you treat more people with less personnel. So the biggest challenge is to get okay with the physicians, because this is the enemy of digital health. You know, when physician thinks that the computer or the cell phone will take their place, this is wrong way. They have to understand how they can work together. I think the COVID-19 is a big opportunity to do so, to convince physicians they can see more patients, they can have more patients, they don't have to get worried about it that they would pay less. But the challenge is also for the economic guys to let them have more money and to see more patients through the cellular.
So it's not replacement, it's evolution. You have to evolve into a new role.
Exactly. By the way, the same thing with, let's say, automatic support decision systems. There is now a big hype in Israel about recommendations or what to do or automatic protocols. There is like treating diabetic patient or COPD, it's became to be more and more complicated. There are about 25 different medications you can sign to a diabetic patient. Which doctor can see all this decision tree making? How can you make your decision? You don't have enough information sometimes, or you don't see the information, or it's too complicated. So you need to use AI for that, for sure. You need to have a support of automatic decision-making tree or any other support tool. Or the same thing with medication. Some chronic patients come with 20 different medications they take. How can you know which medication will be the best for them? It's really complicated to understand that. So you need a computer to assist you. Today, most of physicians don't do that because they don't have access in their computer to all of those SaaS services about controlling medications. I think it should be done through a cloud, a mandatory cloud that everybody have to use it. Not just if you are in this fund, you can have it. Like Kaiser Permanente would have it, and this private one won't. It should be an ethical code. What?
It has to be universal. It has to be applicable to everyone.
So I think the voice of health in India is a part of bringing the demand for the right regulation with the voice of health, with the voice of the people. And this is very important. But they should collaborate with physicians, with unions, with associations of doctors or radiologists. Let's take automatic radiology for a big challenge, okay? You know, radiologists in hospitals hated the idea of automatic radiology. Now, take, for instance, the patient goes to have his CT. You are a specialist in this domain, so you would know about the story. A patient goes because he has a pain in his back, and his orthopedic signed to him, go to have a CT. You see the CT, And he goes back, he treats his back, and after 4 years he died because he had a lung cancer. And then his family checked the CT, and they said that there is a spot in the lungs. Why didn't you treated him? Why? Because the radiologist was looking at the spine and he missed a spot in the lungs. But when you work with automatic radiology, the machine tells you, oh, you have a red light, stop, there is a spot on the lung. So every radiologist would say, yes, it's very important to use AI. But before, or let's say 5 years ago, it wasn't like that in Israel. Now they say, yes, it's making me think again about this city or that city, where to stop and to check other things which are suspicious. So I think it should be mandatory. It depends how deep you get in, how big is the budget, how good is the technology, how solid it is. Many questions about that, but this is our challenges.
Oh, I think you highlighted a lot of very interesting points, and you have amazing experiences. You have dealt with lots of countries. So, since we need to wrap up in short time. Some informal questions for you. Who is your particular idol or the leader that you look up to? Is there any leader who has inspired you to be the person you are today?
Yeah, sure. It goes back to adventures. My leader, or the one I'm looking at, is Sir Winston Churchill. He was defining when the Germans were bombing London, he was defining success. You know how? He said success consists of going from failure to failure without to lose enthusiasm. So this is a success. So if you are and this is about Winston Churchill, but the real guy that got into our heart and home is, you wouldn't believe, is Mahatma Gandhi. Why? I'll show you something interesting. My son came home a few years ago with a job from high school to write about a leader or somebody, and they choose Mahatma Gandhi. And then I was exposed, he was making this picture in his own hand.
Wow.
As a part of the work, you know. And the idea was Satyagraha, which I loved the most. And it's one of the greatest philosophy I could find. And it's the same idea as Winston Churchill said. Satyagraha, what is beauty about it is it appears spontaneously. You need to think about it, you need to lead to there, and it's a non-violence, like with no much violence, just to be a stand of it. And I think this is our obligation as people who deals with creating the future, is the same idea as Satyagraha, or the same idea as Winston Churchill, to go from failure to failure without to lose enthusiasm. So about technology, we have to be a stand for it, and it will become, the future will create it. We don't have to fight the system, you know, you have to go with the system. It's combined between those two. Was it clear?
Yes, very, very clear, and especially I can easily see that fitting very well with the startup life. You fail, you run, you stand up, you run again, you fail again.
Again. Yeah.
Keep running till you become successful.
Mm-hmm.
So, thanks a lot, and thanks a lot for sharing all these wonderful views. What do you think of VOH broadcasts?
Oh, I think first of all, you are a great moderator. You're really empowering me. Every time I say something, you can find the good thing of what I've said, even though that my English is not that fluent. So thank you for that. So I think they choose the right moderator. But now, if I would be serious, when I first met Dr. Naveen Nishal and Miss Pinky Chahar last October in Mumbai, it was amazing to meet this organization. So I was sure that everything they would do would be with high quality. I saw the passion of their hearts and their soul to do better for India. So the same thing with this broadcasting. I think it's a good chance to hear many people. Look, like India, people can. It's really inspiring to see that they were choosing even me from Israel to come and to say my words and to share it with India technology people or India health people. It's really a good idea to do so, because you can learn from other destinations, you can learn from other countries, you can listen and you can choose for yourself what is better for you, and you can implement it. So I think it's great opportunity.
Well, thanks a lot. I wish we could go on with this truly engaging discussion, but unfortunately, that's all the time we have today.
Yes.
So much for wonderfully illuminating and inspiring session, Jacky. I'm sure the points and themes we touched upon today will provoke positive thinking and
Yeah.
trigger timely interventions within the healthcare community.
Thank you very much for this opportunity. It was fascinating to be with you and to listen to your passion to technology and health in general.
Thanks, and we hope to have you again with us sometime.
Thank
Uh,
you.
so, dear viewers, we at VOH really appreciate your tuning in today. We hope you enjoyed today's episode. Till the next, that's a good vibe from Sanjay. Thanks. Bye.